Hey guys, Dr. Childs here. Today we're going to be talking about lab tests that every thyroid patient should get. And so we're not talking about thyroid lab tests here. We're talking about other ancillary tests that you should also be getting in addition to your thyroid. Now, what I'm going to describe here, we have about 17 things that we need to talk about. So it's a fairly large amount of information. But bear with me because it's going to be really important, and we'll talk about why all these tests matter if you have thyroid issues and so on. And also I want to say that these tests lay the groundwork for a great foundation. So you don't have to get these tests every single time you get your blood drawn. But if it's your first time getting your blood drawn, or if you've never had them drawn before, you definitely need to start with these lab tests because it'll give you, like I said, a lot of information about what's going on in your body. So we mentioned before that it's important to test more tests than just your thyroid, right? Hopefully you guys know that, but if you don't, let me just give you 4 reasons why that's the case. So number 1, your thyroid affects almost every system and every cell in your body. That's why the symptoms of hypothyroidism can range from things like fatigue, you can get brain fog, you can get menstrual irregularities, you can get cramps and body pain, and so on. And the reason that these symptoms are so diverse is because your thyroid is affecting all these cells in your body. So it's important to look at all these other areas, and we can test for these things by looking at your bloods or your lab tests. Number 2, your thyroid affects other hormone systems and leads to imbalances in these systems as well. We'll get to why this is important in just a second. Number 3, your thyroid affects your ability to absorb nutrients and leads to deficiencies. It can also make existing deficiencies worse. And why do these things matter? Because number 4, these imbalances and problems and hormone issues and so on, they are not corrected with just thyroid supplementation alone. Okay, so what this means is if you have these problems and you think that all your problems will be solved if you get on the right type and dose of thyroid medication, you're wrong most of the time. And the reason is because just fixing this problem, just fixing your thyroid isn't enough to now also address the other deficiencies that you now are a result of your hypothyroidism. So things like B12 and iron deficiency and so on. You need iron and you need B12 to fix those problems. Just fixing your thyroid doesn't fix all these problems. And so this is where this ties in with my last video, which I talked about thyroid tunnel vision. And this is one of the reasons people don't understand why they're not feeling better. So if you haven't, go back and watch that video because it'll explain the symptoms to look out for so you don't get thyroid tunnel vision. So let's get on to the lab test. But first I want to just say a word quickly about insurance. So what I want to point out is that these labs should be covered for about 99% of you. I've ordered these tests hundreds and hundreds of times. In fact, sometimes I'll order them several times a year on the same patient for the same insurance. So I know that there's not a high likelihood that they'll be denied or anything like that for any random insurance because I've used them all the time on various insurance companies around and so on. But if there's any concern, call your insurance company. Just make sure you do before you get the labs drawn. If you go to your doctor and you ask for them and they say, hey, your insurance won't cover them, so we're not going to order them, that's usually code word from the doctor's perspective that they just don't want to order these tests, because what you can do is you can just call your insurance and say, hey, will you cover them? And they'll almost always say yes. And they will definitely cover them if you have the right diagnosis codes. So in my experience, just using the code hypothyroidism and vitamin D as in dog deficiency, those two things together is sufficient to allow insurance to cover all these things. Now, if it's not covered, yeah, this will be probably a couple $1,000s. So make sure that it's covered before you go get them done. But like I said, 99% of you should be able to get all of these things covered, 100% free, as long as it's covered under your insurance. But make sure you check, okay? Because I can't promise that, obviously. Okay, so number 1, we're going to go through these. I have about 17. We'll kind of go through them and I'll explain a little bit about why they're important. Now, I'm not going to get into the optimal ranges or anything like that right now, but what I will do is I will create a downloadable PDF so that you guys can get this stuff a little bit later. I don't have that right away, but I will add it so that we can download it. And when I do get it, it will be added to my list of all the free resources. So there's a link below that takes you to the page that I think there's on my website that has about 8 free resources. I'll just add this, so this will be number 9, but give me a few days to get that up and going for you. So you can download it so you can take it in and get all these lab tests drawn. So number 1, onto the lab test now. Number 1 is serum magnesium. Now I don't really care if you get serum magnesium or RBC magnesium. Okay, these are 2 different ways to check for magnesium levels in your body. But I do care that you look at your magnesium. Now, you're going to see a recurring theme here when I talk about certain nutrients like B12, magnesium, folate, and vitamin D to some degree. And the theme is that even though I don't trust the lab tests very well to determine whether or not you're truly deficient, there is still some value in getting them. So I do want you to get the serum magnesium or RBC magnesium. Now, again, I don't care which one you get. Some people will say RBC magnesium is a little more accurate. Whatever. If you want to do that, that's fine. But again, the accuracy is not that high in general. So getting slightly higher than whatever's low to begin with is not that great. But you should check it because you can check for obvious signs of deficiency if present. And the reason this is important with your thyroid is because your thyroid directly impacts your magnesium. magnesium. It can cause either low magnesium or high magnesium, depending on whether you have hyperthyroidism or hypothyroidism. So do check. And also magnesium is involved in some 300 cellular processes, so it's very important to your body in general. Helps with sleep and so on. So it's really important. Number 2 is vitamin B12. Now, B12, in my opinion, is probably one of the most underappreciated and underdiagnosed, I would say, deficiencies among all these things. And the reason is very simple. Doctors know that vitamin B12, when you check it in the blood, is not very accurate, but yet they live and die by that number. And I see this trend among even patients too, where they'll look at their B12, I'll say, hey, you should take B12, and they're like, I don't need to because my B12 is high. I'm like, no, it doesn't quite work that way. So let me just briefly explain why that's the case with almost all nutrients and hormones for that matter. So remember, when we check it in the blood, the only way that we can check these values is by looking in your blood. But really, we don't care what's in your blood. We really don't, right? We only care if those nutrients, if those hormones and those vitamins are getting to your cells. The blood is just a highway to get there. Okay, so what we're doing is we're sampling the blood, we're sampling the highway, and we're hoping that whatever's in the blood is going to make it to the cells. But it doesn't work that way, okay, right? So remember, even when we're talking about thyroid, even if it's in the blood, doesn't mean it's getting converted, doesn't mean your cells are receptive to it, or you have the right nutrients to allow it to have the positive impact on your cell. So just what's in the highway, which is in your blood in this case, doesn't really matter to us. However, it's the best we got, so we're going to order it, okay? So check your vitamin B12, but just realize that a low value is more beneficial, like that tells you for sure you're low, but a medium or high level doesn't necessarily tell you you're deficient. But do get it for those reasons I mentioned. You can also and should also check folate. The reason I like to get these both together is because you can get a kind of a decent idea as to whether or not you have MTHFR defect and that genetic mutation just by looking at some of these lab tests. So I do think it's worth it, and it allows you to do that without actually checking your genetics. So there is some value there. Yeah, you might need to get that genetic test at some point, but this is a nice, cheap, easy way to get it and allow insurance to pay for it in the process. Number 4. So those was 1, 2, and 3. We're on number 4 now. So number 4 is vitamin D. Now, vitamin D has a little more value than these other ones. It's a little more accurate. So it is worth it to look at that and to look at your value. But do make sure you're checking it out, especially if you have thyroid issues, because vitamin D is associated with the function of your immune system. So low states of vitamin D can lead to increased risk of autoimmune disease, depression, gastrointestinal distress, and so on. So you do want to be checking for your D. And supplementing. And by the way, so we talked about these 4 things. Now you'll find, I talked about these 4 in the beginning because I think they're important. Not more important than these other ones, but just because I wanted to lump them all together. But this is part of the reason why I do recommend supplementation for pretty much every thyroid patient, because you're almost always going to find one or more of these things that are deficient because of how your thyroid impacts the absorption in your gastrointestinal tract. So keep that in mind. Supplementation is very important for thyroid patients for that reason. Number 5 is leptin, serum leptin, and it should be fasting leptin. Now, leptin is very important because it helps you understand, I would say it's pretty much required if you have thyroid issues, but it's really beneficial to help you understand why you have extra weight gain on your body, or why you have an inability to lose weight. And so leptin is primarily responsible for that, and really we're looking for leptin resistance when we check for that. Number 6 is a combination of 3 lab tests, which includes insulin, hemoglobin A1C, and blood glucose. And the whole point of ordering all these tests is to assess for one thing, and that's called insulin resistance. So insulin resistance along with leptin resistance kind of do the same thing. They tell me the same thing in the body. They're a reason that you might be overweight or that you might have trouble losing weight. So they are really important because they can help direct your treatment. Insulin should be in the fasted state. Hemoglobin A1C is an average blood sugar over about 120 days. Do make sure you're getting that, but realize that it's not super accurate because the life of your red blood cell can vary between individuals and so on, but still get it. 7, 8, and 9 include estradiol, progesterone, and free and total testosterone. Okay, so these are all your sex hormones. Now, you definitely want to be ordering these if you have thyroid problems of any type. Now, estrogen and progesterone become less helpful if you're menopausal. So if you're over the age of probably 55, you haven't had a cycle in 2 years, they're not going to be really helpful for you. And the reason is because we know when women hit menopause, estradiol and progesterone, they go in the toilet. They basically become as close to zero as you can get. Now, if you're premenopausal, between the ages of 20 to, let's say, 45, you're going to see your progesterone slowly go down over time, but it may drop precipitously if you have thyroid problems. And you might see your estradiol kind of go up. And so we're really interested in the difference between these two things. But what we'll see among hypothyroid patients is that estradiol goes up and progesterone goes down. And it increases the distance between these two. And that leads to a condition called estrogen dominance. And so that's a really important thing to know about because you can treat that. Number 9, as I said, is free and total testosterone. Testosterone, and I would include DHEA in here as well. These are really important because they help you understand sort of like they can be very valuable if you have autoimmune disease like Hashimoto's, because you can use some of these androgens to help treat the autoimmune dysfunction. Because we know that certain androgens, DHEA, testosterone even, what you can do is if you supplement with these, they can actually improve your immune function as well. So do check for that. And if you have low testosterone, you may experience symptoms such as the inability to lose weight. You might have the inability to put on muscle mass. And then, of course, you might also be irritable. So those are sort of the symptoms that women experience when they have low testosterone. Again, very important. Check all of those together. Number 10 is sex hormone binding globulin, or SHBG. And what it does is exactly as it sounds. So it binds to your sex hormones, predominantly the ones we just talked about before. But we're not interested in its effect on those hormones. They can be important. We're more interested in the fact that only 2 hormones increase SHBG in the body, and that includes estrogen and it includes thyroid. So what we can do is we can use the SHBG to determine if your thyroid is where it should be. Because especially if you're menopausal, we know that your estrogen is going to be 0, which means that your SHBG is predominantly affected by whatever your thyroid is. So if we give you thyroid hormone, we should see that SHBG go up, right? So we can use that as a tool to determine whether or not your thyroid medication is working. So very important. Do keep an eye on that. Number 11 is cortisol. Cortisol, again, very important. And here I'm referring to serum cortisol, not salivary, meaning from the saliva in your mouth, or urinary, meaning from your pee or your urine. Okay, I think it's a lot easier to just start with the serum cortisol. You can move to those other ones later if you want. I generally recommend against those. I've had other videos explaining why. I'm not going to get into it now. But serum cortisol is a great way to start, and it's really simple, and it can tell you whether or not your cortisol is good or bad. If it's normal, that doesn't mean it's normal, but it's a really cheap and easy way to test whether it's low or high. You can do that really quick. Number 12, whatever, I don't have enough fingers for this, but number 12, we're on iron studies. So this includes things like ferritin, iron, TIBC, and percent saturation. The reason we care about these is because your thyroid can impact how much iron you have in your body. And also, the amount of iron, especially ferritin, impacts how well your thyroid hormone works. Okay, so this is what happens. This is a relationship between iron and hypothyroidism. So the hypothyroid state, which is, your thyroid is lower than it should be, causes your body to not be able to absorb much iron. Then because your iron is low, it causes your thyroid to depress and function, which then causes your body to not absorb more iron. So it constantly kind of goes like this, constant down, 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 down. So it causes a big problem, and it's a vicious cycle between those two. So you need to be looking at your iron, and you need to be addressing it if it's present, or if there's any issues present. Number 13 is your cholesterol studies. So this is just basic cholesterol studies, including HDL, LDL, and total cholesterol. We're not talking about the advanced cholesterol lab tests that you can get from a Cleveland Heart Lab and so on. That's probably better if you're more interested in your cardiovascular risk, like your risk of heart attack and so on. Here, I'm really just interested in looking at total cholesterol as a sensitive marker for thyroid function. Okay, so what do I mean? I mean that there are people out there who are otherwise healthy, but who have, the symptoms of hypothyroidism and this, relatively normal thyroid test with this random red herring high total cholesterol. In my opinion, and the way that I use it, is total cholesterol can be used as a sensitive marker for diagnosing hypothyroidism, especially in that preclinical/subclinical state. So total cholesterol is really important there as well. Number 14 is something called Comprehensive Metabolic Panel. So it's CMP for short, but what it includes is a bunch of electrolytes, and it also includes your liver and kidney function. So you do want to check all these things because it's a really nice way to just knock them off the list and make sure everything's fine. But what I'm really interested in is your AST and your ALT, which are markers for how well your liver is functioning. Okay, so for a couple reasons. Number one, because if your AST and ALT are high, that might be a sign that you have something called fatty liver. Right, that's probably the most common reason for just a slight elevation of AST and ALT. It used to be alcoholism, or just overconsumption of alcohol, but nowadays it's due to too much sugar. Okay, so it causes fattiness in the liver, and that kind of, you can think of it as glue inside the liver, and it affects how well the liver functions. So we care about that because number one, it's a sign of insulin resistance, which again relates to how well you're able to lose weight. And number two, if your thyroid is not functioning appropriately, then it might not be able to convert your thyroid from T4 to T3. A lot of that occurs in the liver, which we care about. And number two, there are certain chemicals and endocrine disruptors that your body comes into contact with that must be eliminated through the liver. All right. And if your liver is not functioning well, guess what's going to happen? Those are going to build up and they're going to impact your thyroid in a negative way. So we really care about your liver. We do care about your kidney too, but kidney doesn't give us quite as much information. And the way you check your kidney is by ordering your creatinine. That's probably the easiest way to do it. Okay, so that's number 15. 14 and 15, they're kind of lumped together. Number 16 would be your inflammatory markers. And again, very, very, very important. I know I'm saying everything's very important. That's because I wouldn't have included it on the list if it wasn't very important. But inflammatory markers give you a lot of information. And the ones I've included here are ESR, CRP, and then ferritin. We'll talk about ferritin in just a second. So ESR stands for erythrocyte sedimentation rate, and CRP stands for C-reactive protein. Now, what these things do is they give you a pretty good idea as to whether or not there's just generalized systemic inflammation in the body. Now, if there is, that's a good sign. Well, it's not a good sign, but it's good to know that it's there. Let's put it that way. Because inflammation negatively impacts the thyroid. It reduces T4 to T3 conversion. And then also, it can be a sign of some sort of immune issue or an indication that maybe you have an autoimmune process or disease or some sort of issue like that. So you do want to check for ESR and CRP. Now, for sure, because it can guide your treatment a little bit. But ferritin's another one that you should be getting, but you're going to be getting it to look at your iron anyway. Now, ferritin, this might be confusing, so I'll make it simple for you. Ferritin in low levels is a sign of iron deficiency. It's pretty sensitive for testing for that. In high levels, it doesn't mean you have high iron. In fact, most of the time when ferritin's really high, it could be high iron, but a lot of the times it's inflammation. So ferritin's valuable at lower levels, not as valuable when it gets higher and higher. So number 16. Number 17 is autoimmune markers. So really what I'm including here would be the thyroid antibodies. Now, most of you will probably know that you should be checking for those at baseline with your thyroid lab test, but I'm still surprised. I get a lot of patients who come to me, they'll show me their labs for the second opinion, and they have never had their antibodies to Hashimoto's ever tested. So thyroid peroxidase and thyroglobulin antibodies, they've never had those tested, which is just crazy to me. So I'm including it here in case you don't get it with your thyroid lab test. They absolutely need to be tested for. Okay, so I know this was, thanks for bearing with me. I know this was sort of a long list. Now, what I'm going to do is I'm going to go through and I'm going to make individual videos on these because it'll help explain what an optimal range is and how to use these more appropriately. But I want you guys to know that this is a really great place to start. This lays the foundation for all that, for how you need to start, okay? And what it does is it lets you know, it helps direct your treatment. So if you have a lot of inflammation and you didn't know you had Hashimoto's, well, maybe you need to focus on your inflammation. If you're having troubles with your weight, then you can know, well, is it cortisol related? Is it leptin related? Is it insulin related? Is it related to my sex hormones? You know, what is the cause of my fatigue? Is it vitamin D related, which can cause fatigue? Is it vitamin B12 related, which can cause fatigue? Or is it my thyroid? So checking all these things really helps give you direction and focus in your treatment. It also helps prevent thyroid tunnel vision, which is what I talked about yesterday. Okay, so that's pretty much it. If you guys have any questions, leave them in the comments below. And remember, I'll include this list below, but it will not have the optimal ranges and things like that. I will include that, though, as a free download in the days to come. So leave your questions below, and otherwise, I'll see you guys in the next one.